everyone. I am just wondering who is here. Who have we got?
Yeah,
Who
we
have we
don't.
got? I see. Yes, somebody. Swati is there. Good morning. Good morning. Nice to see you. Have we got anybody else there? Yes, and Ankita. Ankita, I've seen you before, right?
I don't remember, honestly. I'm so sorry.
And who else have we got here? Vijay, Aman, Ashwini. Okay, wonderful. So, if it is in any shape or form possible for you to turn your videos on, that would be great because it makes a lot better for connection. Because we're looking at each other and just staring into the blank screen is a little bit more harder for me. Anyway, I would like to welcome you all. There's another brave soul, Sana. Hi, Sana. Okay,
Hi.
so we are going to be talking an hour of EFT. And you know why we're doing this? Because we are going to bringing emotionally focused therapy for couples to India. This is a modality that was created by Dr. Sue Johnson. And maybe we just say a little bit, this is Aditi over here. And maybe Aditi, you would just like to say a couple of words and introduce yourself, Ricky and myself, and I bring the PowerPoint up.
Okay. So, hi everybody. I am Aditi. I am a trauma therapist trained in EMDR therapy. However, EFT is something that I wanted to get myself trained 5 years back. And apparently, I still have that feeling that I really want to do it because I keep reading about it. I keep using it with my couples, and it works wonderfully. But since India doesn't have a lot of active training in EFT, we thought that let's get it in our country so that we can get trained here rather than going outside or doing it online because I wanted to do it in person. So we are doing EFT ka training in this December. And Heike, I am so grateful for you to come here and train all of us so that we can learn how to work with our couples and de-escalate them because that is a challenge which I'm pretty sure all the therapists here and all around the world feel. And
Yes,
EFT kind of actually works with every culture. So this
yes,
is something I'm very confident, and I want people in our country to have that equipment to work with the couples, be able to deal with them, and also create a community of EFT therapists in India. That's about my vision, my agenda. Haika is a very, very senior and a very experienced trainer, EFT practitioner. She's been coming to India for almost 40 years. And she has really great roots in our country. She works with Indian couples, she works with different cultural couples, and she also trains EFIT, EFFT, EFCT, all the modalities. So thank you, Haika, for coming here.
thank you,
And
Aditi. Thank you, and thank you for your enthusiasm because I believe EFT will be a miracle for you people working in India with couples. I did an introduction to EFT in Delhi in the beginning of 2020 and wanted to then um,
Heike,
uh,
I'm just coming
my,
into, sorry to
yes,
interrupt. It's just that we see your presentation mode.
yes.
We
Okay,
see,
so I don't know what's happening here.
so if you could sort of end the show and then try that again, maybe.
I will share that again. I will try that again, Ricky. Of course, I will. I will end the show. Okay. Stop share.
yes.
Okay. End the show. Okay. Go back here. Normally I work on two screens, but it is the weekend here, and I don't usually work on the weekend. So just working with one screen is a little bit different. View, presenter view. How's that?
It's still doing that thing, Heike, for some reason. I'm
I
not
don't know.
sure
I
why.
I don't know why
Um,
that is doing it.
could
It,
you try the use slideshow option at the top, the third option?
yeah, you won't see
Okay.
your notes, but yeah, you could just say, yeah, right next to end show, Heike,
Slideshow. Yeah.
there's
Yeah.
tips and oh, never mind.
Yeah. I know the slideshow
Okay.
thingy. Okay. Maybe Ricky, you say a little bit about yourself. Sorry about that,
Yeah,
people.
no worries. I could say a little bit in the meantime. Um, and Ronak, we are recording on my side, so please do not worry for now.
Okay,
Um,
how's that?
yeah, that's better. That's perfect.
That's
Yeah.
better.
And I'll
Okay.
just quickly say, hi, my name is Ricky. I'm originally from Vrindavan, Mathura, very close to Agra and Delhi, those of you who are from up north. Um, and I currently live in Vancouver, where I work at the EFT Center here. I'm a certified emotionally focused therapist for individuals, couples, and families. And I actually first came across EFT when Heike did her introduction all those years ago in 2020. And since then I've sort of followed EFT. I did my first training on Zoom through Iran because it wasn't available in India, and I've attended quite a few trainings since. And yeah, I am really excited about. Last year we had an online externship for India, but this year we're actually coming in person to Delhi, which is really always really exciting because especially with couples work, I mean, it can get pick up really fast. So to actually learn those skills in person, there's just nothing quite like it. So I am super excited, and I'll be there in person as well to assist Heike there. So really looking forward to it.
Right. Thank you, Ricky. And I've got this sorted now. Thank you, Ankita. And so EFT for couples, just a little bit of a background, emotionally focused therapy. In the 1980s was conceptualized and published by Sue Johnson and Leslie Greenberg. It is now the best researched model for couples therapy and has the gold standard for the American Psychological Association. We now do EFT for individuals and for families as well. And this presentation and the training is all based on Sue's research, development, and her training. So lots and lots of research. So there is a substantial and impressive research base. If any of you wants to have a look at that, it's the www.icceeft. And I have a feeling there's one C too many in here, Ricky. Right? I think it should be ICEEFT.
Heike, I'll put a link in the
Yeah,
in the
put
chat.
a link in the chat box.
Yeah.
Okay. So what we are basically doing, or what they have been looking at in the research, is how the change is happening within and between the partners. And the studies have found that the interventions of EFT change partners' attachment. So we have all got attachment strategies, from avoidant to disorganized to anxious and secure. And the aim is to get to a secure attachment strategy. The protective strategies show us people that go woof, very loud, very angry, very attacking, or very defensive. The follow-up studies have shown that the changes that the couples have made are staying, and brain studies demonstrated that after a course of EFT, the brains of the individuals were responding very differently to threats. So have a look here in this link, the drsuejohnson.com.videos. Okay, so just to say that there is a massive research base behind this, and is the best well-known and the most effective couples therapy right now in the world. And distressed couples don't create sufficient positive interaction. They can't soothe each other. They are not staying emotionally engaged. This is what John Gottman is saying. And here it gets to, my friends, whether we have got an arranged marriage or a love marriage, it doesn't matter. Because when a couple gets triggered emotionally, if one of them, let's say the female, finds she can't rely on her partner, the partner is not doing what he says he would be doing, whether it is coming home on time, whether it is doing some stuff around the house, whether it is remembering her birthday, whatever it might be. There's always this sense of, he's letting me down, I'm not important, he doesn't love me, or he doesn't respect me. And that over time, bit by bit, gets so big that when there is an anxious attachment style going on, the person starts attacking. The person starts getting louder in order to pull the other person in. And then oftentimes the other partner feels like a bit of a failure, and they start getting defensive, and then they get loud. So that's the pattern that we are seeing. And that pattern is basically there with most of our couples. And it is usually a sign of an unmet attachment need. And I don't know what you know about attachment needs. And I'm wondering whether you might want to put some of that in the chat box. And you can't do it wrong. What do you think is an attachment need? What do we all need? What do we all need? What are we wanting when we're in a relationship? Could you put that in the chat box? To feel loved? Yep. Wanted? Important? Aditi, you don't know the work. Get respect? Feel hurt? What about some of the men? Feel valued, cared, comforted? Great. Okay. So secure attachment. And what does secure attachment mean? It means I can rely on my partner. I can rely on my partner. Okay. Now something has happened here. I've somehow or other paused the jolly screen sharing. So I have to go back to it. Sorry. Share here. Can you see it?
Yes,
Yeah,
we see it. Distress is a
okay.
signal of an attachment.
So it is basically the need to feel safe, loved, important, respected, heard, understood, belonging, all of that. So if you have an arranged marriage, you might start off with not knowing the other. You might not even know the other. You might be very lucky that you think it's amazing. However, what do we definitely want is respect, isn't it? We want respect from the other. We want to know that we are important. And if we get a sense that we are not, and we're feeling abandoned, we have a fear of being unloved or maybe overwhelmed, then we get distressed. And we have different ways of showing our distress. And in some cultures, people swallow it more. And in other cultures, it comes out a lot more. And I think you might have a mixed version of that in India. And sometimes you get a very escalated couple where both of them, one is very attacking and the other one attacks back. Would that be right? Attack. Or you might have one that is defending and the other one shuts down. Yeah? Or they both shut down. Or they both accuse each other. So for avoidant partners, they usually shut down. They might also defend. An anxious partner, oftentimes, they go louder and they start attacking with the intention to pull the other one in. So what are we actually doing here? There is a sharp attack in an escalated couple, and we're calling that find the bad guy. Who is wrong? Who is to blame? So the blame goes back and forward. Have you seen that in your therapy room, or does it only happen in New Zealand? Ankita is saying that she's seen it, and Sweta is saying she's seen it too. Anybody else that has seen it? Maybe you can tell me in the chat box whether that is fitting with you or not. Aditi has seen it. Swati has seen it. Okay. Okay. So Vijay has seen it. Thank you, Vijay. I appreciate to hear that, I'm not the only one that sees those couples. So that's always the who is wrong, who's to blame. And then what we have is we have a fast and rigid dance of blame and hostile criticism, followed by either explosive anger or stonewalling. The tension is very high and very unpleasant. And we as therapists can get quite overwhelmed with that. So very little effect regulation happening here. And it's not effective. Whatever they're trying is not effective. So in that case, we are unable to shape base in session when the therapist is unable to shape the secure session base in session. They might become dysregulated themselves. And what will happen with the couple? What will happen with the couple? Aditi, what will happen with the couple if you are unable to shape a secure base in the session?
Lots of frustration, lots of anger, screaming, shouting, shutting down, and probably not wanting to work on their relationship, not wanting to work with us because we are not able to hold that sense of safety for them. So it's like an entire bundle of chaos.
Yes, a bundle of chaos, and they possibly won't come back.
Obviously.
Ankita, I am happy to see you nodding that this is something that is also known because it makes a lot of sense. It makes a lot of sense. So the challenge is to keep the emotional balance, to identify the triggers, to get the pattern, because the pattern, the pattern is right in front of us, in front of our very eyes. What we'll be doing in the externship, I'll talk a bit about that today. But what we will be talking in the training, we'll talk about how people are managing their distress in relationships and what the interventions are. Lots and lots of role plays, lots and lots experiential role plays to help you with that. I've been working as a therapist since 1990. That's a little while ago, right? And this model is amazing. It works. It's a good model. Otherwise, I wouldn't be teaching it. I think we have got Ryan here. Is Ryan here? Ricky?
Let me see.
Because a
I
colleague
do
of
not see
mine,
Ryan here yet.
not yet. Okay, so I'm hoping that he will be coming because he's a fellow EFT therapist in New Zealand. He is he comes from the Philippines and he's been in New Zealand for maybe, I don't know, 10 years about, and has done a lot of research, works with a lot of different modalities. And he wanted to talk a little bit about how he finds it because he worked with Southeastern couples basically all the time. So we want to basically find out what is the pattern, why do they get so escalated, make sense out of the attachment strategy that they're having, the intention behind it, how it impacts, how the one reacts. And then the idea is tracking and tracking and tracking and tracking. They escalate, you need to calm them down. They escalate again, you keep on tracking, you calm them down. So it is the first few sessions. Some can take up to 8 to 10 sessions before the work is actually that you feel okay. Whew, it's not so intense anymore. Yeah, so it can take some time. And we are working with the attachment lens. And the attachment lens is that we make sense out of what they want to achieve. So I have a question here. Ankita is saying, in India, men don't like women correcting or calming them. So they take offense to women jumping in and trying to relax the situation. Yes. Okay. So when I said calming them down, it is normally that they feel shut down. That's not what I want to do. I don't shut anyone down. We work in New Zealand a lot with people from the Pacific Islands who have a very similar cultural background, that the men are really the head of the family, the men are the protectors, the men are the ones in charge, and the modality works amazing. And what I need to do is, I don't want to dismiss anyone. I don't want to dismiss the person that is angry and yells. And I don't want to dismiss the person that goes small and doesn't know what to say, or gets defensive or stonewalling, whatever. So we are not dismissing anything. What we work with, we don't pathologize. We don't pathologize. We don't put label on people. We just, we understand through the attachment lens. We make sense out of it and we validate. And then we say, yes, we get that. I get that, Vijay. I get it. You get so angry at Nikita over here because you think that Nikita doesn't respect you, and then you get angry. And your anger is about, well, she doesn't respect me. Okay, it's about respect. I get it. When you don't feel respected, you try with your anger, you try to, well, to respect me, to listen to me. Okay. So that's what happens. And that you get angry because you somehow want to be heard, you want to have a voice. And when she doesn't see, so your lens hearing you, that's when you start shouting. Am I getting that, Vijay? Yeah. Okay. And when that is happening, when you are starting to shout, that has an impact on Nikita. Nikita, help me. So then we start tracking the whole thing. And we need to get an understanding of what's happening between the two of them. Okay.
You know,
Okay.
there's lots of things you can do with it.
I have got a question here. The moment that Ryan appears, please let me know. Yeah?
I will.
Okay. So, is it recommended that a therapist conducts one-on-one session with a couple individually to understand them better before conducting a session as a couple? Okay. Swati, we have got a system that we work with. We have got an amazing roadmap. This is one of the things that I really, really like, and that my trainees really like, because that means you have got a system. You've got something that you can rely on that helps you in your work with the couples, because couples work is like learning a new language. Just imagine you were now to learn French. Maybe you already speak French. You would not learn French by just looking at one video and voila, you can all of a sudden, you are fluent in French. It is something that you need to learn. And the same happens here with couples. We can work with individual clients. It can be amazing. But that doesn't mean that we have the skills to work with couples, because there's an entirely different dynamic. Yeah? Does that make sense? Yeah? Okay. Now, I wanted to show a little video. Would it be good if I just, Swati, that answered your question. You said thank you, yeah. So we have a system. We usually see the couple together first. Then we see them each individually. And that is, of course, everything, all of that gets covered in the training in detail. And then we go back together. We talk in the training about assessment. We talk about contraindications. We talk about what happens if people have addictions, if people have severe mental health issues and such things. And then normally after the third session, we carry on with the couple together. Okay, so situational anger of the male in the couple. So it can be male and can be female. The anger, the situational anger can come from male and female. We have to understand, are we having intimate partner terror, or are we having situational anger outbursts? Do you understand what I'm talking about these two things? Yes? Okay, so what I'm talking about here is that the intimate partner terror is when one partner, and it seems to be more that the male partner does that, controls the female partner to such an extent that the female partner has no ability to do anything by herself. There's a lot of jealousy involved. There is control over money, who she sees, who she texts, whether the family can come or not, when she can go out or not, all of these different things. Sometimes even what she can eat. Yeah. Control has to be sexually submissive, all of these different things. And then, of course, there can be the anger and the violence on top of that. Situational anger is usually a defense mechanism. And when we are working in shame honor cultures, where people basically try to, there is a lot of respect given to people that are in positions higher than us, they're more senior, and there is shame gets put on people oftentimes in order to motivate them. Yeah, so parents might shame the children to motivate them. You are not as good as the kid from next door. I'm having a situation that I have got two Indian foster children. I say children, but they actually, one is 22 and the other one is 24. Okay, so they're already young adults. And the girl has been fat shamed since she was about 3 years old. Like, you are ugly, you are fat, you will never get a husband. Every day. Stop eating. What are you eating? You're eating those potato chips again. You are so fat, you are so ugly, and nobody will ever want you. The amount of damage that girl has gotten through that is beyond any clinical book I've ever read, because I live with her. It's incredible. Is that making sense? Shweta, you understand, Ankita? Yeah? So, we use that then. This girl grows up, is 25 now, or tomorrow she's 25, or in 2 days. Has a boyfriend now. Of course, you can imagine the attachment style. Is disorganized, wants a relationship, is scared like anything that she will be rejected. So she just pulls back before, when the boy comes forward. And then when fights are happening, and the fighting is going tough, we will then want to shame the other one. That is, for instance, one way of using a tool to hurt the other one. When I feel like I'm not being understood, then I yell, and I might yell really horrible things at the other person, and the other person feels ashamed. And then out of that shame, anger can arise. That's one action tendency. Another action tendency of anger, of shame, is to withdraw. But when the anger arises and it gets really hot, a little bit of hitting can come in. And it just gets faster and faster. Am I making sense here? Yeah? I'm relying right now on Sweta and Ankita, who are basically the only ones I can see. And Sana, I can see now, and Malvika, it's really good to see you nodding, because I don't know whether that is landing what I'm saying here. Yeah.
It's making perfect sense. In India, shame culture is very prevalent.
Yeah.
We always compare to our neighbor, and in academic circle, in terms of marriage,
Yeah.
suitability, in terms of everything. There's a constant comparison which is used
Yeah.
to motivate your children, and even in sports. Like, I'm also a sports psychologist, so there also I see the coaches always ridiculing the child, saying this is how we
Yes.
motivate.
Yes. Yes. Exactly. And it has such a bad effect. And the interesting thing is now for me, because I have lived with this girl now for 2.5 years. I see it daily. The depression, it is outstanding. It really is. And then, of course, the overeating, right? Overeating, and then getting more, right? It's quite phenomenal. Okay, so I am glad that this is all making a little bit of sense. If both the partners are having traumatic experiences in their life and want to give it a try to their relationship, yet the male doesn't seem to openly communicate with the female, and female feels the burden of relationship along with her trauma, is it good to hold on to the relationship? Vaishnavi, thank you for that question. It is not up to us as therapists to decide whether the couple stays together or everything is Hogia. No, we don't do that. We have to leave that to the clients. But our job is to understand the pattern they're stuck in. And it is not always the male, my dear Vaishnavi. In 2/3 of the cases, the male has the avoidant attachment, but in 1/3 of the cases, it's the female. Yeah? So it's not always the male. So if they're having both the traumatic experiences and the open communication, this is something that you're basically working with. That's basically happening with every couple. The couple comes in, and if they were to communicate amazingly, they wouldn't see you. And so they come in with, Zana, we don't agree about how to raise our child. Ankita, my wife doesn't like my mother-in-law, my mother. Sveta, the finances. My wife spends too much money, and you have to you have to tell her off, or whatever, right? And the examples might not be amazing, but it just goes on and on. We are not talking about the mother-in-law, nor are we talking about the child, whether the child should sleep with mama in the bed or with Peter or by themselves or whatever they're doing. We're not looking into solutions where the child is sleeping. We're looking at how do they get stuck that they can't talk about whether the child is going to school at 4 or at 5, whether the child sleeps there or there. How come they can't talk about it? They can't talk about it because something happens in the communication. Something happens. There might be a tone, there might be a word, there might be an eye roll, there might be something, and poof, the partner gets triggered. Here we go again. He's not listening. And then we're not talking about the lunches anymore. We're talking about he doesn't listen. And then the meaning making is happening. And then the action tendency is coming, the protective strategy. Then the other partner gets impacted, and off we go. So from that point of view, we basically, it is our job to find the pattern. So I would like to show you something. This is Dr. Sue Johnson here on the right-hand side. This is a consultation session. The video is about 2 minutes long. This person here on the left-hand side is Jason. He's an EFT therapist. And he thought, okay, this is a time to show one of my worst tapes to Dr. Sue Johnson, get some feedback. Great. Yeah? Okay, so he brings this tape along. I would like you to watch, and I would like you to get a sense of what the therapist is doing wrong. Okay? There's several things that he's not doing right, and some are really quite wrong. Okay? Ready?
All right. So we're going to look at another piece now. Now we're going to look at an escalating piece. Is that the...
I think both clips from this session, any clips from this session, we would see them.
Everybody's laughing. Everyone's laughing. So this is going to be a nice piece of escalation, is it? All right, fine.
With Christmas lights up. This year I made an effort to put Christmas lights up because her and my daughter like them. I could care less if there's Christmas lights on the house. Put a great deal of effort up there, put the Christmas lights up. Had a lot of problems with them. They weren't working, and I troubleshoot. Ends up I can't get them to work, so I take them down. Well, you know, it's when are we going to get those lights up? Let's get those lights up. Gets my daughter on the bandwagon. Dad, are you going to get those lights up?
I did not do that. I can't help that she likes
It's
stuff.
never just, wow, God, that is beautiful. That other thing didn't work out, so that's great. But look at this. This is awesome.
I did say that.
So it's just never good enough.
Sophia's aware of everything, and you know it. I didn't
It's never
prompt her. I
good
don't
enough.
prompt
So
her.
then she starts working on the lights, and usurps me and thinks she can do it. If I can't do it, how is she even possible going to do it?
Yeah.
So then usurps me and hangs them up or uses something. Or it's just.
I didn't hang anything up. I tried to do something, and I put it away.
I just want to back things up a little bit.
It's never just. Those lights are great. Sorry it didn't work out, the other thing. Let's just leave
I
it
don't know
alone.
why you're talking about lights.
Because it's just part of this whole thing.
Part
It's
of
never
what?
satisfied.
See, it's about what I did wrong.
Because you're never
How come you don't
satisfied.
take any responsibility for anything ever? You never say you're sorry about anything.
What did I do wrong with the lights?
I'm not talking about the lights.
How do you do the lights?
Jesus Christ, I did say, okay, that's cool.
Because she didn't
And Sophia and I
like
drove around
them.
and
It
looked.
wasn't
That's
good
not
enough.
true. Maybe you feel
How
guilty.
come we can't have these lights here?
I can
you
ask
made
questions.
clearly a point.
You tell me
I
I
said
can
they
ask
don't
questions.
work. They don't work. But you went in the garage to try to
Whoa.
So, what did you, and it would be great if you would come and we could discuss this a little bit. Some more of you could put the videos on. That would be great. I stop the sharing right now. Okay. Okay. Now, what did you see happening? What did you see happening here? Ankita, could you just help us a little bit with what you saw happening?
So I noticed that the therapist had given some tasks to the couple, 2 tasks, which the husband is talking about, that out of the 2 tasks, the second one they couldn't do. The first one is what he's describing, that it didn't work out in terms of coordination, and they had an escalated situation where, according to him, he did the task as best to his capacity. And as per his memory, the wife has pointed out his imperfection, which he's unhappy about. And the wife keeps trying to butt in and say, hey, but my entire point was not about the lights. I was trying to communicate something else to you. So he's rejecting her, and he's still in his emotional escalation state that you did tell me I am wrong. So out there, he's expressing his hurt, while wife doesn't want to hear that. She's feeling that he's rejecting her. So now she's in an emotional state. And in this dance, the therapist is like subdued by the anger of the husband and probably just trying to butt in, but not able to.
Not well, he doesn't even give it a go, right? So he basically stays silent. He gives it a go. He has one intervention. Rita, you were here for a second. Do you want to come back? I was so keen to hear your voice.
I'm curious if the therapist just keeps saying, "Oh, but wait,"
Yeah.
if they're trying to do that,
Yeah.
and the client just goes on and on and on and on.
Yes.
So,
So
do you get louder?
me, Ankita, of course, because what did you see happening? We saw a minute and a half. What do you see happening with the escalation? Was it calming down?
No, it's just
It
gonna
was
get
going
worse.
up. So the longer you let it run, the worse it gets. He had the little but going on. And Vijay, there you were for a second. I was wondering whether you noticed something. If you want to say something. Otherwise, we have got Ria. Ria, what did you
Hello, good
notice?
afternoon.
What was the intervention that you saw the therapist making?
I think when I was like observing the couple entirely, I think there were a couple of things that I noticed. However, the therapist was not very audible to me, but I feel that one or two lines that I heard was on the lights part of it. I
That's
think
it.
he was,
Yes. Good.
yeah.
Yes.
And I think other than focusing on the feeling, there was the couple was talking about responsibility. The couple was talking about, if I can't do it, so can't you do it. I think
Yes.
these were some of the patterns that coming
Yes.
up.
Yes. So Ria and Ankita, you were both going in the right direction here. The therapist, I'm starting with Ria. Ria, is it Ria? Okay. Ria, you noticed that the therapist was saying, so what about the lights? So they're talking about the content. We don't want to talk about the content. We want to talk about the dynamic. The dynamic. So he gets completely flooded with the content because the man was just going on and on what he did here and there and da 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 da, right? Okay. If you start going into that, what happens inside of you, Ria? If you start listening to all the details about the Christmas lights, what happens in your little body?
I feel that if I was there in the place, so now we were viewing this as a third person, of course,
Yeah.
and I feel that I would obviously focus on the main core element and not on the Christmas light. I think Christmas light just was an event of
Yes.
explaining the
Yes.
situation to me.
Yes. Yes.
So I would obviously focus on the element part of it. So for me personally, I think something that would go inside for me is what is the element, what is the core, what is the conversation crust,
Yes.
that is something that from the lens that you mentioned that I need to see it. Yeah.
I
So that
think
is something that
you're very right here. However, there are many people who focus on the content. And if you focus on the content, it has a big result on the therapist. And the result is I feel overwhelmed. I feel completely overwhelmed. And then I sit there and try to get the detail of this and this, right? I'm asking more about the lights. So this is what he didn't do right. He got sucked into the content, which is easy. That can happen to all of us. And the other thing is, he did not focus on the dynamics. He didn't focus on the dynamics. And the dynamics were here very clear. You could see the cycle in the room. He was super defensive. And she was butting in, sort of like telling him he wasn't right. Yeah, pointing out what he didn't do right. That sort of dynamic, right? And the more she did that, the louder he got. And the louder he got, the more upset. And you saw her and the eye rolling and all of that was happening. Am I getting that? Okay. So this is the dynamic. And at that point in time, we need to interrupt. And I'm just wondering whether we should watch maybe 3-4 minutes of that video that I did, that training video that I did. Would that be helpful if we showed a little bit of how I work with something like that? I'm aware we've only got 15 minutes left. Maybe just 5 minutes. Can we have a little bit of a you know, in the chat box, a little bit whether that would be helpful?
Heike, I see quite a few thumbs up that came
Okay,
on
thank you,
people's
darling, because I
boxes.
can't see anything.
Yes.
Yes. Okay. Yes. Okay. So we just have a few minutes. We are aware this is a tiny aspect of couples therapy, but it's a very important one, and especially in the beginning. Okay.
Heike, do you have the video, or would you like me to pull it up?
I have the video. I will just share it with you all.
Okay.
As in, you'll be sharing your screen, Aditi?
Yeah, I will be sharing the screen. I'm just kind of trying to.
Okay. I have it ready to go if you.
Okay. Well, if
If you have it, then that's perfect.
Vicky, you go.
Okay.
Yeah.
All righty. Let's see.
Okay.
There we go, Heike. Where would you like me to start?
Just start. We just watched a few minutes, and you can see or watch, please, the interventions that that you can see me doing, and put that in the chat box afterwards. Okay. Just let's do 5 minutes max.
Okay. You want me to start from the beginning, Heike?
Yes, yes, yes. Okay, you two. I am just wondering how you've been since the last session, and whether you've had any sort of like negative cycles and you were able to
It hasn't been good.
Okay, it hasn't been good. Okay. Is that okay? We have a little look at what wasn't good. Jan and Angie, is that okay? We have a look at that?
Yes.
Sure.
Yeah. Okay. So Angie, tell me a little bit of what hasn't been good. And Jan, I'm coming to you.
Well, Jan has told me that his parents are coming. And then he tells me that it's all about trying to support me. It is not supportive, his parents coming. It is horrible.
Okay, so
it is horrible.
Okay, and what happens? What happens when you are saying to Jan, this is not supportive? What happens between the two of you?
She is just complaining. First she says, oh, I need help. Then I'll bring in help. Then she's complaining about that.
Jan,
it is not.
Angie, stop.
No, I've got to tell you this.
Stop a second. Jan, could I just have a minute or two with Angie? I'm coming back to you. I need to hear you too. I need to hear both of you. So
what happens is, Heike, what happens is he says it's supportive. He paints this beautiful picture of his parents coming, and then his mother niggles and niggles and niggles at me when Jan isn't around. She is so horrible to me. And I try to tell him and he doesn't believe me.
Okay, so when
he never believes me that his mother is mean.
Okay, so Angie, when you
never believe me, do you, Jan? You never ever believe
Angie, this is really, really, really perturbing you. And I am just wondering, because something is happening in between the two of you here. When you are saying to your precious husband, this is not working. This is not working for me. Your mother is criticizing me, and I feel so bad about that. And
when he's not
if
around,
only she said that, she screams straight away.
So,
but that's because you don't listen to me, Jan.
And this is what I want to stop. This is what I want to understand how that works. Let me just see whether I'm getting it. Jan is bringing in the parents or the mother-in-law in order to give you support. This is from what I'm hearing from Jan's perspective. It doesn't work for you, Angie. I'm hearing that. And when you, Angie, are saying this is not working for me, this is not working for me, right?
Horrible.
Yes, it's horrible. It's not working for me.
It doesn't work, and he won't believe me.
Right, and so when you get a sense that he doesn't believe me, what do? You get very sad. I can see the sadness right now. Yes, and you get louder. Is that what
I get? I'm trying to tell him how I can't live like this when
Okay.
someone doesn't believe me. And he always sticks up for his mother. She
Okay.
is awful.
Like, I
Okay.
can't live with
Okay.
help. I can't live without help.
Just a second. So, Angie, I think I'm getting that. When you are saying, this is so hard for me, when your mother is coming, because I feel so criticized, I'm doing my best. And when you tell him, and my sense is you're telling him in order to
get him to help me, to get him to understand.
Okay, to
get him to support me.
Okay. And when you start with that, and you get a sense that he's not hearing, you get louder in order to reach him. Am I getting that?
You are getting that. I have to get loud because he never listens.
Okay. Thank you, Angie. So let me just summarize that before I'm going to Jan. So from Jan's perspective, Jan, I see you're shaking your head, but I want to come to you. This is Angie's side of the cycle. I want to hear yours as well. So Jan is trying to support you by bringing in some physical support. And for you, this is not working, I'm hearing, Angie, because you feel criticized. And when you are sharing this with Jan, hoping that he'll understand, hoping that he will stick up for you, Jan seems to be, what I'm hearing, seems to be not sticking up for you. And the more he doesn't stick up for you, the more you sort of like get louder.
I get loud.
Yes.
And I don't want to be loud, but I have to get loud
because
he doesn't hear about how cruel his mother is.
Okay. And you want him to support you. And
Yes.
the more you through your lens get a sense that he's not listening, the louder you get in order to reach him, because it's so important that you have his back. It's so important that you somehow or other feel that he supports you. Yeah?
Yes.
You get
I
louder.
want his support.
Yeah, right. And you want him to support you because the relationship is important. Thank you, Angie. Let me just have a look over here with Jan. So when Angie is wanting to communicate, Jan, I need you. I need you to support me emotionally here. I need you to stick up for me. Yeah? When she is trying to communicate, what are you hearing? Because it sounds to me like you're not hearing that. Angie,
She never says that. She only complains. She only complains about my mum, about my dad. All of a sudden they're in the way. This doesn't work, that doesn't work, and I'm not helping. And that's why I brought them over, that they aren't helping. She's just complaining constantly.
It's so not true.
Angie. We just had a little agreement that I would get a couple of minutes with Jan. You had a couple of minutes. Can you just listen for a moment? Okay, so Jan, when Angie is protesting, please hear me, please support me.
May I stop sharing, Heike?
Yeah, stop sharing. Okay. Were they escalated? Yes. Okay. So, could we use the chat box? And I would like you to, if you can take that risk, to share in the chat box what you saw me do. What did you see me do? Asking both to follow rule, hear each other, no interrupting. Yeah. And how often did I do that? Once? Ria, you're laughing. Interruption, summary, focus on the dynamic. Exactly. Use louder voice. Commanding the room. Exactly, Ankita. I need to be in control. So I can be totally quiet and really slow. But if they are going like this, I have to be louder. Otherwise, they won't hear me. Taking control. More than once, whenever it got off track. Expression, emotion behind behavior. Exactly, Ankita. So on the outside, and that is it, she gets loud, and I got that from her. She gets loud because she wants him to back her. Because the mother-in-law somehow or other, some issue there. But did we talk about the mother-in-law? We talked about what happens between the two of them. So setting boundaries, summarizing the motive more than once, use louder voice, interruption, okay. And normalized Angie's emotions, Sana, very, very good. I normalized and validated. So how did I normalize? What did I say to Angie? What did I say to her that made her feel like a little bit more like this? I validated Jan's emotions as well, yes. And how did I validate? Ricky, did you hear me? I reflected the feelings. Ricky, did you hear?
Yes.
Responded to body language. Yeah, did that as well. I used their names. Angie, 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 Angie. Going to like this, right? Ricky, how did I validate?
You validated that is normal. Are you speaking of Jan or are you speaking about Angie?
Both of them, both of them.
Yeah, you validated the fact that this is what they're intending to try to get from the other person. They want the support, or you validated
Yes.
when the other, all you see in the other person is the anger. It makes sense that in this moment that for you it's hard to hear.
Yes. So that was 6.5 minutes. I worked hard. And I said she was feeling sad because there was sadness in her eyes. The tears were already coming, was already happening. Yeah. But it is the beginning of the session. I am not in the beginning of therapy when they are so escalated. I'm not saying, oh, tell me about your sadness. I see your sadness right now. What's the sadness saying? No, it wouldn't work. I need to go with the anger, because she doesn't express her sadness. The sadness expresses itself in the anger. And woof, out it comes. So this is what we are going to be learning, and much more, when I'm teaching the 4 days of externship in Delhi. And I would like you guys to come. Would anybody like to come? Yes? Oh, Sana, that's nice. Smeta, you as well. Oh, that would be wonderful. I would like some of you to come. I would really like you, because I tell you, I don't know how many people I am supervising and trainees I've got, but I can tell you that everybody here in my city, this is the second biggest city in New Zealand, all of my supervisors are full to the ceiling. To the ceiling, full. And what my colleague didn't make it, he just sent me a text. He said, I'm so sorry, I fell asleep. Okay, next time coming. But what he was going to talk about was that he has worked extensively with CBT, with couples, with the Southeast Asian couples. He says they come for 2 sessions, maybe 3, and never come back, because you have no tools to deal with any of that. And since he's been working with EFT, the change has been mind-changing, absolute game changer. So I can only recommend that you do come, that you do sign up. And Aditi, we're coming to the end for today. I would like to, before we're coming to the end, I would like to tell you where to register, because we need to really know what we're dealing with. We need to have people on the ground in order to actually make this happening. I'm coming, the tickets are booked, but we need to know whether we have got 20 people or 30 people or 40 people or 50 people. I wouldn't have more than 50 people. I don't want to have that many people. And we work in small groups. Yeah, I do the presentation, you go off in smaller groups, and there's practice, 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 because that's what you really, really need to do. And what is Richa saying? Would like to join you in Delhi. Richa, we would love to have you. I wanted to say something else. What did I want to say? Ricky, what was I just talking about?
You're talking about the effectiveness, well, a moment, yes, and then you were also talking about registration, how to do it.
Registration, how to do it.
You want more than 50 people. You would want to keep it small groups so you can do role plays.
Yeah.
Yes.
If I may interrupt, I believe you were talking about how we work in smaller groups for practice sessions so that it's
yes. So we work in smaller groups, so you get lots and lots of practice done. My idea is, that's how I train, 90 minutes. Each little segment is 90 minutes long. PowerPoint, maybe a demo, role play. Presentation, demo, video, whatever, role play. Like this, it goes all day for the 4 days, and we will have a live session or two, so that a couple will come in. That I hope that Aditi will bring a couple in. We have to talk about that, and that's the normal thing that we do. That we have a stage 1 couple, and that I work with them, and we have to see whether that is in the same room with you or whether it is in a room next door and we zoom it in and put it on the screen or something like this. Then we discuss it afterwards and we do the role plays afterwards and all the rest of it. Yes, so that's what we're doing. And did you find that helpful what we did today? Can I have please, Ricky, can you have a look whether there's any sort of like feedback, whether that was helpful?
I see nods and thumbs ups.
Yes, I saw a heart. Oh my God, I got a heart. That was good. A heart and a little thumbs up here. Thank you for the little emojis. And I love that some of you had the courage to put your video up, because we're working with people. And for me, I'm sitting here, I'm trying to sort of like bring some of that knowledge to you. And when I can see some of you nodding, and Zana's just sitting there and she's got the pen here, and I know she's possibly thinking, Nikita made some really good comments, Sweta made good comments, Vijay showed his face. That was good. Yeah, if that makes sense.
Yeah, of course. It was actually very informative, and I'm very new to EFT. I'm just learning about it. This is actually my first introduction to it, and talking with you has been really great.
Good.
Listening to you, basically.
So please have a look on YouTube. There's a lot of videos of Dr. Sue Johnson. And this is not a therapy that has just come out of the blue. It has been around for 40 years, and it's amazing. So please come, don't miss this opportunity, and sign up. Is there any special, Aditi? If they sign up today, do they get a special?
We do have early bird discounts. We have student discounts. We are also offering scholarship to some people. So there are a lot of information. I will post it on the group today. If anybody of you need any kind of information, you have any questions that need answers, you can feel free to drop a WhatsApp to me anytime. I've put up the registration link on the chat box as well as my phone number that's on WhatsApp. Feel free to drop a message and we can get on a call, or if you want to discuss more, we'll do that. But we have discounts going on. I will put all of that on the group right now. You people can see whatever you require.
When you say group, you mean the chat right now?
No, Ricky, we have all the participants in WhatsApp group as well. We just made that today, because of the registrations we got. So I'll put all the details on that group now itself in like 5-7 minutes. And if anybody of you have any kind of questions, any queries that you need more answers for, you can drop our messages over there. As I told you, to build the community. So we want people to keep talking, keep bringing out their issues, bringing out their questions, and we're going to support as much as we can.
Okay, so Aditi, am I hearing you right that you have created a WhatsApp group India now, EFT India, so you can actually talk on that WhatsApp group and you can do chattings there. Wonderful.
Yes.
Yeah. And I would really also want to say you will not regret it. This this is a model that works and it gives you support. So you actually are successful in what you're doing. Okay. Ankita, whereabouts are you in India?
I'm in the southern India.
You are in southern India. Right. Okay. Well,
And
Delhi is nice and cold, isn't it, in December? But
I just don't enter Delhi for the 3 months of winters. Like I have that. I belong to Delhi. My hometown is Delhi. I just don't go there.
yes,
I
yes,
just disappear
I can
every time.
understand that. I can understand that. Yes, I just hope that December normally at least the pollution is not as bad as it is in the beginning of November.
It's at the maximum. So you're going at the worst time. At least for me, that's like the worst time to enter Delhi.
Yes. Yes.
And I know my immunity is not there, so I do not go into Delhi during
I can
December and
understand that.
January.
So we'll see. But I hope that I see some of you, maybe Sana and Sveta and whoever else was saying they were going to come. And for tonight, I'm saying goodbye. So take really good care, Ria. Take good care. And
thank you so much for being up late and doing this for us. Thank you so much, Aditi, for organizing this. This was really insightful. Like I mean, seriously, you're a wonderful trainer. I feel sad if any of us are missing out on it. I think everybody should go there and do this and probably have a virtual option also for people who can't travel. Talking about myself.
yes,
We are
thank you for that, Ankita. And you know what? In person, online, I mean, I've been training online for the last 4 years, but in person, particular for the Indian population, is more effective because we have you get the feedback, you get the vibe more in the room.
And also, when you're talking about emotional regulation, what I have experienced is when the couples are escalated state, the kind of dissonance it creates, like, you yourself as a therapist are so dysregulated.
That's right.
Online, the impact is just different.
That's right. And that's why the in-person, that's why let's do it in person because it's you get more. You get more. Okay, my friends. Good night for now.
Thank you.
We'll see you soon.
Thank you so much.
Okay, Sana. See ya. Okay, bye, Ria. Bye, everyone else. Ashwini, goodbye. Vaishnavi, everybody. See you. You were great.